And with that, going over to English now, Anna, I want to start with you. May is Mental Health Awareness Month. What does that mean to you?
Yeah, absolutely. And for us, it's a really exciting month. Mental Health Awareness Month really creates an opportunity to us to promote mental wellness and mental health in general. We know that we all as humans experience mental health the same way we do physical health. And so it really helps bring mental health awareness to the forefront, and help reduce stigma. I think there's a lot of misinformation around mental health and mental wellness in our community, and normalizing it is crucial, as it's something that we all have as human beings. And I think Mental Health Awareness Month is also an opportunity for us to advocate for our communities on what services are needed and continue to really grow and increase access to care for populations or our communities that are most at risk or most vulnerable. And so I think that through this promotion this month really helps Servicios kickstart our efforts to recruit community members and inform community members of a holistic health festival that we will be hosting in the month of July for BIPOC Mental Health Awareness Month, at La Raza Park here in North Denver. So it's super exciting month, and it's an opportunity we have to really educate community around mental health.
Exciting indeed. And well, Anna, we also, of course, know that mental health is taking on extra attention during the pandemic. What are one or maybe two simple things that we can do each day to improve our mental health?
Yeah, absolutely, Chris. And I think, COVID impacted all of us both directly and indirectly in many ways. And many ways we don't know the full psychological impacts of the pandemic will have on people, especially our younger folks. Many people missed really crucial times in their lives, such as graduation ceremonies, school activities, and things like that. So I think it's really important that we listen to our gut instinct and trust when to ask for help. But I think some things that people can do that are super common and accessible to most people. One is movement, anything from taking a short walk, dancing, moving, running. If people like to play sports, really does help reduce stress and anxiety, which we know has been exacerbated over the pandemic. So now that the weather is getting nicer, anything we can do to get outside and move around will really, really help our mental wellness. In addition to really taking time to ourselves, right? Sometimes taking a day off might not be possible, but doing small things such as cooking our favorite meal, reading a book, listening to music, watching a show can really help reduce that stress and then improve our overall health outcomes.
All right, there you have it. Don't be afraid to take some of that time for yourself a little bit there. Doctor, I want to go over to you and ask you about how mental health affects physical health.
Thanks, Chris, for that question. And I want to say that I always think that we have to approach health in a holistic way. The definition of health is a state of well-being that includes the physical, mental, social, emotional, and environmental aspects of our life. We need to see all of those things. We try to put them into position to see where we are. For me, trying to see that someone is healthy means try to see someone who's leading a happy life. And when you have a burden on your mental health, you start to lose hours of sleep. You start to lose concentrations, start to have problems with your relationships, and all of those things start to accumulate. A lady that I knew some time ago said it's like if you're carrying a bag of potatoes. It's not just rocks, it's potatoes, because they start to grow, they start to rot, and they start to be heavier as you go by. And this is the way mental health will start to affect different areas of your body. There's certain conditions, physical conditions, that are related to stress or to depression and anxiety. And all of those things improve when you have a good mental health. So I would go to treat what is more essential, which is having a very good mental health. That will help a lot with physical health.
Work on that mental health. Now, in terms of physical health, of course, the pandemic is still ongoing. So, Doctor, can you tell us a bit more about the vaccine clinic that Servicios de la Raza is organizing tonight and this week?
Thank you. We are organizing pop-up clinics in different areas. We have at the Mexican Consulate every Tuesdays and Fridays, and we have it here at Servicios de la Raza starting at 4 o'clock. So if whoever wants to come, just give us a call and we'll be happy to give them the vaccine. And it's really a very fast process. Hopefully we'll get first timers coming in to get their vaccine still. This weekend, we're not going to be having any event, but we will keep on doing Tuesdays, Fridays, and the weekends as time goes on.
Well, great. And that means more time for yourself this weekend, and get to do some cooking and dancing, whatever it is you want to do. But Ana, Doctor, we really appreciate the minutes of both of your time today and taking a closer look at COVID-19 and specifically some of those mental health focused themes surrounding the pandemic as well. Thank you both for your time here today.
Thank you, Chris.
Yeah, thank you, Chris.
No problem at all. And that'll do it for this week's look at COVID-19 and mental health, specifically in the Hispanic community here in Colorado. Gracias a todos. Thanks to everyone for watching, and we'll see you again here next week.